Hello, my name is Dr. Brett Greenky. I'm the president of Syracuse Orthopedic Specialists. I've been an orthopedic surgeon serving our community for well over 30 years. Our SOS professional organization has 25 surgeons and over 600 employees that pride on providing expert and compassionate orthopedic care to the Central New York community, for which we're committed. The crisis of COVID-19 has enveloped not only Central New York, but our nation and world. And I wanted to let you know that SOS is responding to this stress in a way to support our community. SOS offices have remained open, as our surgery center has, to take care of people with acute problems. SOS is the first big organization to test all of our patients and staff routinely every morning. We've been doing that for 6 continuous weeks. Every staff member that comes into one of our offices or our surgery center gets a questionnaire about the risk factors of COVID. They get their temperature taken, and that happens every single day. Every patient that comes into our office gets the same evaluation every day, and that helps us keep the risk of our patients and our staff to a minimum. During the crisis, in response to the need for continued care, in addition to screening the patients on a regular basis, SOS has developed a virtual visit software that allows patients to have the visit with their physician on their intelligent device, either a smartphone, an iPad, or a desktop computer. We've done hundreds of virtual visits. And even after this crisis ends, it's likely that virtual visits will be an option for patients in the future who have difficulty coming to the office for a physical visit. During the crisis, SOS has responded to the needs of the community by donating personal protective equipment to all 3 of our neighboring hospitals, Crouse, St. Joe's, and Community, and to family practice groups who are on the front line screening patients who have upper respiratory symptoms. SOS has continued to contribute to our charitable organizations. In addition, SOS has helped, along with Syracuse University, start printing 3D face masks that are used by anesthesiologists and emergency room personnel to protect them when they're interacting with patients who may be infected with COVID. We're proud of that. Emergency operations, by definition, is an operation that needs to be done within 24 to 48 hours. Urgent operations within a week. Those 2 types of surgeries have continued. Elective surgeries are surgeries that could be delayed a month, but probably not more for comfort of the patients. And those operations have been delayed during the crisis for safety of the patients. We wanted to make sure that our healthcare system was not overwhelmed. And fortunately, in Central New York, that has not happened. With the guidance of New York State Department of Health and our governor, it's likely in Central New York that elective surgeries will be begun again with some discretion over the next 2 to 3 weeks. We are preparing our nearly 2,000 patients who need surgeries to prioritize them and make available times for surgery upcoming, hopefully in May or early June. As I mentioned, emergent surgeries have been conducted during the crisis period, as have urgent surgeries. How we define those surgeries is not a judgment we've left to one specific surgeon. We actually have created a committee of 8 physicians, each in the different subspecialty of orthopedics: total joint replacement, spine surgery, hand surgery, sports surgery, foot and ankle surgery, etc. And that panel votes on a surgery that is proposed to be urgent or emergent. And if it's felt by the committee that surgery warrants a designation of urgent or emergent, then that surgery is performed. The committee's designation of an operation of urgent or emergent, we're following the guidelines of the CDC, the Department of Health of New York State, and the WHO. If you have questions about your care specifically, or you would like to be a patient of SOS, feel free to contact us directly. Our phone number is available. The sosbones.com website has links to all of our offices and facilities, and there's educational material there that you can peruse and contact SOS as needed. I'd also like to thank the community for our continued trust in us in providing high quality, compassionate orthopedic care, and certainly to our staff of over 600 employees, many of which have been working part-time or even been furloughed temporarily during the crisis. Obviously, we cannot provide excellent care, surgery, and non-surgical treatment without the team approach. It's not just the physicians, it's the nurses, it's the surgical technicians, it's the surgical schedulers, it's the billers, it's the administration staff. This is a team approach, and our team is excellent, and without them, we would not be able to support the community and to the extent that we have. So hang in there, everybody, during this crisis. SOS has got your back. We're here. This crisis will eventually end. So just remember, we will be here now, we were here before, and we will be here after it's over.